Hello and welcome. My name is Nawras Al Halabi. Today I'm going to talk about infertility and assisted reproduction. It's a very interesting field in medicine which helps families, helps grow families and help to improve the quality of life. First, to speak about infertility, we have to know first the normal fertilization route. Actually, the sperms just produced in the testes, and then they are moved through the male genital tract, and then it's the semen compositions is added to the sperms, which sometimes they are chemical substances which gives the sperm the nutritions for this, and eventually they just get out of the body by a procedure called ejaculation through the prostate. This is the normal composition of semen as of World Health Organization 2010. Any different numbers in sperm analysis will show some kind of problem. It may lead to severe infertility. The sperm's journey in the female genital tract. The sperm's journey in the female genital tract. Actually, the sperms, this is a race, which just sperms, when they enter in the female genital tract, a lot of sperms just die in this way. So they try to their best to win. They face a lot of obstacles, like mucosity of the cervix or the vaginal acidity. Eventually, only one sperm just achieved the goal and fertilized the egg. And this is a video shows how the journey is done by millions of sperms. So eventually, only one sperm just will fertilize the egg. Capacitation. The capacitation is the strength of the sperm to fertilize the egg, and just the sperms acquire the capacitation in the female genital tract, so they are able there to fertilize the egg. The ovulation. First, the ovulation in the female genital tract starts from the ovary. The egg just has to move through the fallopian tube to the uterus. So it will be fertilized actually in the fallopian tube. This video shows how ovulation occurs. This is how the egg just the egg pulls out of the ovary, and the fallopian tube fimbria just act as a sweeper to catch the egg and move it to inside of the fallopian tube. This is the egg, and this is the follicular fluid accompanied with the egg. So this is fimbria of the fallopian tube, and the egg is moving inside. These are the follicular cells surrounding the egg. Now, after the sperms just get into the female genital tract, they try to move, and this cilia of the female genital tract that should help the sperms to reach their destination to the egg. First, hundreds of millions of sperms just enter the female, but because of these obstacles, many of them die, and in the end, only hundreds of thousands, then they decrease gradually, until only about hundreds just surround the egg and try to fertilize the egg. This is how sperms are surrounding the egg right now, and in the end, only one sperm has to enter the egg. Now, kind of a chromosomal reaction just happened in the wall of the egg. The sperm head just produce dissolving substances, so they can dissolve the wall of the egg and then enter. After only one sperm, which will win the race actually, enters, there kind of reaction happens in the wall, so it's very thick, so no other sperms can get into the egg, so only one sperm can enter. Sperms actually act like cars, so they just only carry the genetic material of the father. And this is the sperm dissolving, and only the genetic material is the important thing. It's composed of 23 chromosomes, and in the egg we can find the 23 chromosomes of the mother, and they just try to fusion together to compose a 46 chromosomes cell. So it's a fertilized egg or zygote. Now the zygote as it rolls into the fallopian tube with the cilia. Follicular cells are fade gradually because of these cilia, and it's now cleavages happen. So it's transformed into 2 eggs, 4 eggs, 8 eggs, 16, etc. And now it falls into the uterus, where implantation starts. This is the inner wall of the uterus, and this is the wall and follicular cells just gone away, and here implantation starts. Assisted reproduction and vitro fertilization. As I summarized the normal, normal reproduction methods. So now I'm going to talk about assisted reproduction or in vitro fertilization, IVF. This is a procedure we do to people who can't have normal reproduction. We help them outside of the body. So, history. First IVF was done in 1978 actually. It has been done by a professor called Bob Edwards. And here's the picture of Bob Edwards. And Louisa Brown, this is the first IVF. This is the first IVF person. She was born in 1978, and this is her mother. Since then, 7 million IVF babies were born till now. And this is a picture of Bob Edwards, who got the Nobel Prize 2010, and this is Professor Nawras Al Halabi, who works in IVF in Syria. Who needs IVF? Actually, IVF is needed when there is an infertility problem. Infertility causes maybe a male cause, maybe a female cause. The female causes maybe blocked or damaged fallopian tubes, or maybe it's because of the male, it's abnormal sperms, endometriosis or immunologic problems in the female also. There are other infertility treatment methods. When they do not work, we can use IVF technique, or advanced maternal age, which implantation fails in this case. Now, how we do IVF? Patients have to know how we do IVF. First, we do ovarian stimulation. In a normal ovarian, only 1 egg is produced per month from both ovaries. Now, because we want to increase the probability of implantation, we do ovarian stimulation to produce more than 1 egg at a time. So we give drug therapy to produce more eggs. Oocyte retrieval. After producing these eggs, we have to catch them to fertilize them outside of the body. We do the oocyte retrieval technique by using vaginal ultrasound and using a needle. This is the vaginal ultrasound, and using the needle to get into the ovary, and this is the ultrasound. Actually, this is the needle. We get into the ovary and we suck all the follicles contents. So we can take out these eggs to the laboratory. Now, after getting the eggs, we have to just prepare the sperms. Sperm preparation is to give them the capacitation that capacitation is normally occurred in the female genital tract. Now we have to do this manually because it's outside of the body. We just give them some chemical substances to give them the capacitation and their ability to move. If we can, the last method was done by taking the sperm directly from the semen. If we can't take the sperms directly from the semen, we can just use sperm recovery to get the sperms from the epididymis or from the testes directly by using FNA or fine needle aspiration. And this video showed how we choose the sperms and how we collect them under the microscope. Sperm recovery, we have two methods of sperm recovery actually. After FNA, testicular sperm extraction TASE, which when we use surgical method to take a sample of the tissue of the testis, and then we search in this tissue to find the sperms and get out in the laboratory. Micro-testicular sperm extraction is another method which uses surgical method, but it's under the microscope. We just take a small tissue. We just search for the white tubes, so they are full of sperm. This is a method we use when there is the tissue of the testis is not enough, so we can precisely find the sperms. Denudation is the method we use to just clean the egg from the follicular cells. This is normally happened in the follicular tube by the cilia. Here we use this method just to, with a glass tube, to just move the egg and take the follicular cells out so we can clean the egg. Also, we search for the normal genetic ovum. So we just choose the genetically normal one. So we can't have genetic diseases also. Now, in classic IVF, is how we fertilize the egg under the microscope. Classic IVF is used to put 50 to 1,000 sperms with one egg to let in the laboratory to let them fertilize normally. This method is used when there is excess sperms and there is normal sperms. This is another photo of classic IVF. This is under the microscope. We can see how thousands of sperms are surrounding the egg. And this is an illustrated photo. Eventually, we will see one sperm just enter the egg. And now it's turned. It just started. Okay. Intracytoplasmic sperm injection. When there is not enough sperms, no normal sperms, so we just have to use this method, XC, intracytoplasmic sperm injection. We don't have enough sperms, so we just try to inject the sperms inside the egg using needles like this. Okay, this is how we get the sperms. Now, immobilization. With XC, we have to immobilize the sperm because a moving tail will damage the egg contents. So we use laser to just strike the tail of the egg, and then it's immobilized. You see how we strike it with laser the tail of the egg, the tail of the sperm. So it's immobilized. intercytoplasmic sperm injection. This is an illustrated photo of intercytoplasmic sperm injection. This is how they put the sperm into the egg. This is another photo showing how we get the egg and put the sperm inside the envelope. Another picture under the microscope. This is a real picture.
We put 2 strands in one egg. What will happen?
I'll answer my question first. Okay. This is another photo of the sperm injection. This is the egg. I will stabilize it. And how we fertilize the eggs with this sperm. This is an illustrated photo. This is a real photo. Now, fertilization. After fertilizing the egg, we have to choose the normal genetic eggs which will convert to normal embryos. We just choose the chromosomal normal embryos like this one. We choose like this one. It has 2 nuclei of the sperm and the egg. These has 3 actually trisomy, and this has damaged the sperm. These has damaged the sperm chromosomal contents. Early cleavage. Now, when early cleavage starts, the egg will turn into fertilized egg. Will have cleavages, and it will be 2 cells, 4 cells, 8 cells, etc. This is a 48 hours video, but it's fast forwarded on the computer. This is how cleavages are done. Day 3. When we have a day 3 embryo, we just have to, now we have a healthy embryo, so we can just transfer these embryo to the womb of the mother, so implantation will start. Sometimes we just wait till the 5th day at the blastocyte phase. So in this phase, we copy the normal implantation. So the pregnancy rate will raise. Embryo transfer. Now, after getting healthy embryos and choosing them, and they are chromosomal normal, we just have to transfer them back to the womb of the woman. We use also vaginal ultrasound and a small needle, and this is a real how these are. This is how the embryos are transferred. This is a very simple procedure which is done while the woman is conscious. Assisted hatching, sometimes the implantation is hard, doesn't occur. The wall of the embryo is very thick, so we use some kind of chemical material to dissolve a part of the wall of this embryo to make implantation occur faster. So this is the embryo, and this is the inner wall of the womb, and this is how implantation starts. Also, we can use the assisted hatching method by using laser under the microscope. Now we're going to struck the wall using laser. This method increases the pregnancy rate in IVF. PGD, or pre-implantation genetic diagnosis, not only infertile people tend to do IVF. Sometimes people with well-known genetic disease tend to do IVF because they always get congenital malformation in their children. So pre-implantation genetic disease, after getting the embryo, we can get 1 cell of the embryo. We are dissolving out the wall. We can just get take one cell and using the new genetic techniques, we can use PCR or other devices, so we can make a karyotype and see which is the abnormal embryo, so we can throw it away and choose the healthy embryo, so we can transfer it back to the womb of the mom. So in this way we can just have healthy kids.
Interesting.
This is the chromosomes. Okay. This is how we take one cell from the embryo. First, we dissolve the wall, and we just take the cell using small needle under the microscope. And this cell, we put it into genetic analysis, so we can know all chromosomal abnormals in this embryo. This sample actually. Sometimes we wait until blastocyte phase, so we can take more than one cell, so the analysis will be more correct, and the implantation of the embryo, because it's composed of more cells, will have more pregnancy rate actually. So we use the laser to cut this embryo and take this sample of cells and put it under genetic analysis. This is the laser. We'll start down here.
So now it's a matter of one cell being cut, or
More than six.
more than
More than one cell. Eventually, the first goal in medicine is to improve the quality of life, and this is why we do IVF and do fertility genetic diagnosis, so we can have healthy kids. I'm going to say a clinical story about a doctor who is from Duma. Actually, he had labor where 9 of them were genetically disordered, and only one was healthy. And we transferred it back to the womb and implanted successfully, and now he has a healthy child.
That's amazing.
This is the first goal of medicine, so to improve the quality of life. Thank you.